So today we'll be going over the disorder Alice in Wonderland Syndrome, or AIWS. Your presenters are Aubrey.
Hillary.
Sabby.
And Sarah.
So what would you do if you couldn't believe what you perceive about your own body or the world around you? So we're going to start off with a video of Dr. Beth Colby giving a brief overview of Alice in Wonderland Syndrome, and then we'll get into more detail.
Alice in Wonderland syndrome is the name given to infrequent, short-lived experiences of sensory distortion, which can be of objects, body image, passage of time or space. It is also known as Todd syndrome. Todd documented that the symptoms resemble those of the fictional character Alice in Lewis Carroll's Alice in Wonderland. A person may experience distortion several times a day for seconds or minutes. This may occur for days on end and then not come back for days or weeks. If it is a child who has experienced these, they usually stop when the child reaches adulthood. The symptoms that people experience occur unpredictably. In some people, sounds may appear louder or quieter than they really are, or it may appear that somebody is talking very fast or very slowly. Objects may appear bigger, macropsia, or smaller, micropsia, or they may appear nearer than they actually are, further away, and they may alter in shape. People may have visual hallucinations. There are over 40 types of visual distortions that can occur. People may see body parts added to people, such as a limb coming out of the abdomen. People may have a reduced sense of passage of time and experience their body changing in size. In over 50% of people who experience Alice in Wonderland syndrome, a cause cannot be found. In some people, it is associated with migraines, infection, stroke, brain tumour or trauma, or epilepsy. Other causes include stress, cough medicines, and hallucinogenic drugs. In children, the main cause is infection, and in adults, the main cause is migraine.
So let's dive in a little more. So this disorder was named by British psychiatrist John Todd in 1955. And as Dr. Colby mentioned, it's also known as Todd syndrome after Dr. John Todd. People with this disorder experience a disruption in the perception of their own body and or other people or the world around them. It's named after the main character in the Lewis Carroll novel, of course, because of the various physical changes that Alice experiences in the story, such as her body growing and shrinking. AIWS can show up in a variety of ways. Depth perception can be distorted, or maybe things seem larger or smaller than they actually are. And in fact, there are so many possible symptoms that in 2016, a review of over 60 years of research found that there were 42 reported visual symptoms and at least another 16 somaesthetic and other non-visual symptoms. What they all have in common is a distortion of perception. So here we see images showing Alice from the story, showing a visual representation of a couple different symptoms. In image A, she's experienced what would be known as partial macrosomatic nausea. So part of the body seeming as though it's growing large in a disproportionate way. Her neck has grown quite long here, but the rest of her body remains in proportion. In image B, she's experiencing total body microsomatic nausea. Her entire body feels shrunken but remains in proportion. So as mentioned, there's an extensive list of symptoms. Let me review a few more of the more common ones people think of with AIWS. We've already gone over many of the visual symptoms, such as body parts of self and others looking larger or smaller or distorted, depth perception being disrupted, etc. So here's some additional symptoms. Feeling like you're detached from your own body or mind, which is called depersonalization. Feeling like your body is actually split in two, which is somatopsychic duality. Feeling that time is moving faster or slower than usual, or even feeling like it's standing still. Sounds may seem distorted, so maybe seem like they're louder or quieter than they actually are. Loss of limb control or struggle with coordination. There can be lingering or fading touch and sound sensations, agitation, nausea and dizziness, or even memory loss. Some other visual symptoms would be seeing things that aren't there, so visual hallucinations, other people looking smaller or larger than they are. A couple that we learned about in class, prosopagnosia, which is difficulty recognizing faces, visual agnosia, which would be difficulty recognizing objects, or objects looking distorted, like straight lines can look wavy, or horizontal or vertical lines can look skewed. So because there are so many symptoms, a lot of the time, and a lot of the time they're somewhat short-lived, it's difficult to find a consensus on the actual criteria for diagnosis. So doctors just kind of end up tending to use their best judgment, and therefore data on the prevalence of the disorder is felt to be somewhat unreliable. So I'll pass it to Hillary.
So, Alice in Wonderland syndrome typically develops early on, specifically in children and young adults. It originates in the temporoparietal occipital junction. Genetics can also play a role in the formation of this disorder. There are also other factors that can lead to Alice in Wonderland syndrome, such as migraines, infections, seizures, specific types of strokes, such as ischemic strokes, hemorrhagic strokes, and transient ischemic attacks. Mental health conditions, medications, recreational drugs or inhalants, brain tumors, and degenerative brain diseases. In most cases, symptoms are temporary, lasting anywhere from 30 minutes to 6 months. These conditions generally resolve on their own. Next slide. This syndrome is diagnosed through a series of laboratory testing that include imaging tests such as CT scans and MRIs that allow for doctors to examine potential structural changes in the brain, spinal tap, which is a procedure where doctors extract cerebral spinal fluid from a patient's spine to test for infections, EEGs, which is a small electrical disc that's placed on a patient's scalp to measure any irregular electrical signals coming from the brain, and visual evoked potentials, which is an assessment of the function of the patient's visual cortex in response to visual stimulation. A combination of these tests allow for healthcare providers to determine the cause of a patient's symptoms, and I'll be passing it on to Sabby.
Alice in Wonderland syndrome can be due to a range of factors. The most common neural cause is migraines, sitting at 27.6% for adults and 26.8% for children. Seizures are also a common neural cause for AIWS. This is similar to migraines in the way that they can both be passed down through genetics. Through an experiment published by the National Library of Medicine, it was found that the temporo-occipital, parieto-occipital, and temporoparietal junctions play a key role in the development of AIWS. This is because visual and somatosensory information are processed within these areas. These findings were further supported in traumatic cases. Individuals who suffered lesions to certain areas of the brain presented with correlating symptoms. Those with more severe lesions in more anterior regions of the brain showed an even wider range of these symptoms. Theoretically, based off of these findings, an injury to the occipital regions may result in more visual disturbances, and so forth. Next slide. As priorly mentioned, AIWS's genetic basis comes primarily from passing down the disorders from which the syndrome stems from. However, there are more compounding factors as well. Drug usage, both prescribed and recreational, can incite AIWS. LSD and other hallucinogens, cough and asthma medicine, as well as seizure medication have all been known to exacerbate or cause this syndrome. As priorly mentioned, it is also not uncommon for traumatic conditions such as stroke and brain tumors to cause the onset of Alice in Wonderland syndrome. So I'll pass it to Sarah.
Treatments. How it affects our bodies. It affects our bodies by the disturbance in self-perceptions, having vision problems, combined symptoms. The list of treatment focuses on addressing the underlying cause, such as migraines, epilepsy, infections, or other neurological conditions, which means there's also no specific treatments for AIWS. Migraines. If migraines are the cause, treatments might involve migraine prevention, medications, and a migraine diet. Epilepsy. If epilepsy is the cause, antiepileptic medications may be prescribed. Infections. If infections is responsible, antiviral or antibiotics might be prescribed.
And these are the sources we use to find the information for this presentation. And that is the end. Thank you.